Hi, everyone. Welcome back for another episode of Wellness Matters. Today, I have a wonderful guest, and her name is Dr. Michelle Young. We are going to talk all things wellness, but she actually is a licensed naturopathic pediatrician, and she is helping children and teens feel better and prevent future disease. She is a medical practice owner and also a health and education advocate. So, she is a clinician by day but runs an educational community by night to help parents figure out ways to do prevention for their children. So, without further ado, I'd love to introduce Dr. Michelle Young. Michelle, thank you so much for being here today with me.
Thanks so much for having me on, Heather. I'm so excited to chat.
Yes, we were actually, I should have utilized my time a little bit better. We were just totally going off the record, talking about all these fun things, whatever. And now I got to make sure that I can fit as much as I can in the amount of time that we have together. So,
We
um,
could talk for hours.
I know we really could. So, anyways, Michelle, could you, like I said in the bio, that you are a naturopathic pediatrician? Could you talk to us about what exactly is a naturopathic doctor and how did you get into this side of the practice?
Yeah, absolutely. So I'm a licensed naturopathic doctor in the state of California. Went to a 4-year medical program, and really the difference of naturopathic medicine, say, versus traditional allopathic doctors, MDs, DOs. MDs really try to utilize the body's ability to heal itself. We truly believe in that innate healing power. And we really focus on trying to find the root cause of symptoms. And so instead of saying using different pharmaceuticals or always jumping to higher level treatments, we may do some deeper digging. For me, maybe doing some labs, doing a much longer intake with my patients to actually try to find the root cause instead of trying to just cover those symptoms up.
Yeah.
And then we use a lot of natural therapy. So every practitioner uses a little bit of different modalities. For me in my practice, I really try to focus on diet, lifestyle, the foundations of health. And then on top of that, I use a lot of herbal medicine. I use a lot of homeopathy, some hands-on physical medicine, and a lot of like mental, emotional, somatic work as well.
Oh, I love that. I have a somatic practitioner coming on soon. So
That's
what
exciting.
could you actually explain what the somatic side of all that is?
Yeah, for me, what that looks like, especially with kids, is kind of just bringing them into their bodies, right?
Yes.
And getting them tuned into how their bodies are working and how
Mm.
that mind body connection is working. For me, this is really important. This is how I really got into naturopathic medicine was through my own health journey. Growing up, I had really bad abdominal pain. When I was eating, I would kind of curl over and I didn't know what was happening. Every time I would eat, I would feel so awful. And it really
Yep.
didn't matter what I was eating.
Mhm.
And that kind of snowballed. And when I was in college, I kind of just had this aha moment of like, I should not feel this way. Like, this is ridiculous. I need to figure out what's going on. And so I went, into the traditional medical model. I grew up in Michigan where I had never heard of a naturopathic doctor. And so I went through the traditional system, did the typical tests, saw lots of different specialists. And basically, they were like, we don't know what's going on,
Yeah.
and tried giving me several different medications. And I just did not feel comfortable with that. And so I had a friend who was actually seeing a naturopathic doctor. And he was like, Michelle, you need to see my naturopathic doctor. And I was like, I don't know about that. I was very hesitant because I had never heard of one.
Yeah.
And so I can resonate with the patients who come to me and are very desperate and have never heard of a naturopathic doctor, but want to see change, right? Because that is how I came into naturopathic medicine. And because I was in Michigan, she couldn't do a ton of testing. She couldn't do any really high level therapies because we are not licensed in the state of Michigan. And so she did basically just foundational, really good naturopathic medicine, changed up my diet a little bit, changed the environment in which I was eating. She added in just a couple really basic supplements to help with my gut. And literally within 3 months, I had never felt so good in my life. And I couldn't
Wow.
believe it. And I remember walking out of my first appointment with this ND and calling my mom in tears and saying, oh
Oh,
my gosh, like this is what good medicine looks like. Like,
yes.
why
Yeah.
is our medical system not functioning in this way? Like, she
Yeah.
cared. She asked such good questions. She asked about diet and lifestyle and stress and environment within the home and all of that good stuff. And it worked. And I saw the
Yeah.
power of it. And
Right.
so that's really what got me into naturopathic medicine. And so for me, I've always really had a love for how our lifestyle and how we're raised
Yeah.
influences health, because that is what influenced my health as
Right.
when I got into naturopathic medicine, but also my health right now. And
I
so,
literally like almost had the same like experiences that you had
mm,
as a child. I still, but then had a very like like nervous system. And
yeah,
so I would get anxious a lot, and not know what to do with it. But anyways, I started to think, oh, it's what I'm eating that would cause me to be curled up on the couch or on my bed. And sometimes I'd cry, I'm like, this hurts really, really bad. So of
yeah,
course, at the time, the doctor's like, "Oh, she's lactose intolerant. Here's some pills so she can eat this before she has the food." I'm like, "These aren't doing anything for me. I'm still getting the stomach aches, and I'm not
yeah.
lactose intolerant. It's not when I'm eating ice cream that this is happening." And so it wasn't until my early 20s when I finally was like, "This is not right. Every time I eat food, I shouldn't feel this way."
Hmm.
And it wasn't just when I was eating food though. I started to like actually pay attention to when it was happening. It was stress related more. So
Same.
once I knew to start taking away some of the things that were causing those triggers and the stresses, then my stomach could start to calm down. But I really do feel like as like a culture, we are so separated from the mind body connection that you were just talking
Hmm.
about. So I didn't understand how to read the signs from my body because my mind didn't understand what was
Yeah,
happening. I didn't understand how to like read the cues or anything like that. So
yeah.
that's how I got into like the mind body spirit connection
Mm,
and on my journey.
yeah.
Um but why do you think there is such a difference in the naturopathic way of medicine versus the traditional?
Yeah, I think training. I think it really comes down to training and philosophy. We
Mm,
really believe that the body is whole and the body is powerful. It is meant to be in homeostasis. We are
right,
not broken. We are not a bunch of different pieces. Our mind is not separate from our
right,
legs. They are
right.
part of one being. And our medical program is not driven by pharmaceuticals. We are not funded by the pharmaceutical industry, whereas we know that traditional medical programs are, for the most part, funded and subsidized by the pharmaceutical companies. Therefore, a lot of their training is mostly based off of you have these symptoms, you get put in this box, and then therefore the next phase of treatment is pharmaceuticals. Whereas we don't believe in that. We believe
Right.
that the body is meant to be in homeostasis, and when given the proper environment, when given the proper nutrients, when given the proper love and support and safety, right? Like safe,
Mhm.
safe energetically, that the body knows how to come back into homeostasis. And so I think it really comes down to uh, the belief that we have, and that really comes from the philosophy of naturopathic medicine. That's not
Absolutely.
taught in traditional medicine, even if providers maybe do believe that, but that's not what's driving their care, right? In traditional medicine.
Ugh, makes me so sad. Do you see it like in the future, things kind of shifting more and having it kind of merge a little bit more? Or do you think this is just the way it's going to be?
I think in my When I am feeling optimistic,
Yeah, yeah,
I like to believe that we, as traditional providers, as well as, say, more alternative providers, will come together and know when to utilize each other. For me,
right.
I think it's really important that it's not them versus us. We need
Right,
both.
right,
We need
right.
both. And I think really where it comes down to is a lot of people cannot afford naturopathic medicine. It is
Correct.
expensive. A lot of states are not able to accept insurance. And so I have a cash-based practice to be able to pay my bills and to be able to support my patients. I spend anywhere from 30 to 90 minutes with my patients. And so I spend a lot of time with them and I need to be reimbursed for that. But the reality
Absolutely.
is a lot of people cannot afford to see
Right.
naturopathic providers, therefore they have to see a traditional provider, right? And so I think that also is a huge limiting factor. I really hope that down the line that will shift and that the insurance companies will shift towards doing some preventative care, right? And
Yeah.
covering preventative care. We as a society would be so much better off if they covered dietary counseling and vitamin D testing and, a lot of education on good foundational health, right?
That's
But
what I was
we're
going to
not.
ask you. I've been to both traditional and naturopathic doctors now for the past like 5 years. Like I kind of just go in and out. And
Awesome.
one of the main things that I have noticed between the two that are completely different is the labs that you're talking about. I feel
Hmm.
like if I go to my traditional doctor and say, "Hey, I'm feeling a little bit of fatigue or whatever, what do you suppose that could be?" I get like a 5 second answer. And I'll say, well, is there any testing we can do? Whatever. And this has happened to me multiple times. They're like, well, not really, whatever.
Hmm.
And then if I go to the naturopathic, they have like such detailed and I don't know, a ton of different
Yeah.
labs that they run. Why is that such a difference in the two?
Yeah. I think it comes down to because we are taught about true root causes.
Okay.
So, for example, I treat a lot of eczema in my
Yes, yes.
practice. And the amount of times that, again, because I'm in California, we do not accept insurance. I try to be very mindful of my patients' finances. And so a lot of them are paying for insurance. And so I say, hey, go to your pediatrician and request these labs so that it'll be covered by our insurance. And then we will review them together. This is
Yeah.
very common. And the amount of times that I send my patients to their pediatrician to ask for very basic labs like vitamin D.
Yeah.
And they will say, you don't need vitamin D. Vitamin D has it doesn't have anything to do with eczema.
Drives
Um,
me crazy.
it is mind blowing.
Mhm.
And I think a lot of naturopathic doctors stay really up to date on the research. I think that also is it's very different in our world. We try to stay up on the newest research, and we also don't buy that people just have these symptoms. And I think
Right.
for me, I don't accept. See a lot of patients that have been told, they'll grow out of their eczema, or they're anxious and that's why they have constipation, blah blah blah. And they kind of just like put that label on them and expect at some point it will go away, and I just don't accept that. I am always willing to do more labs and do some more investigating. We also have a lot more labs in our arsenal. We do a lot of functional testing, which is like a more comprehensive stool test would be more of like a functional lab test. So instead of, we're not just ruling out, say, E. coli or, really overt pathogens that would cause, say, food poisoning or really bad diarrhea. We're looking at the microbiome and how is the microbiome contributing to health. Whereas
Mm,
a traditional pediatrician, they don't even know how to read those labs because they're not taught it, right? It's not
right.
that they're not smart enough to know it. They absolutely do. And I know a lot of pediatricians who have uh, had additional training
Right.
in more functional medicine, and they're like, I can't even imagine not utilizing these labs now
Yeah.
that I have them in my
I
arsenal.
think the most frustrating part is, and literally just this just happened to me yesterday. I went to my GP and I just like for a normal checkup, and I was talking about, the next stages like perimenopause and that kind of stuff. And
Hmm.
the information that he was saying, like I just sat there and I was just like, this is not correct. This is
Yeah.
like, no. But it went into the conversation we were having. I wasn't even going to like have that conversation with him, but anyway, it went into that direction. I was just like, this is still happening. I feel like one of the most frustrating things when you are seeing a doctor is when you're getting the runaround, or you're getting told like you're kind of being belittled in a way. Like
Yeah.
that
You're
is
being
just so
gaslit.
gaslit. Yes,
Yeah.
exactly what it is. And you end up walking out of there thinking, I had all these intuitive hits, and there's a reason why I'm having these thoughts. And yet this person's saying, no, that's not it at all. And it's like, again, when it comes back down to just being quiet and sitting and knowing that the mind, body, spirit is all part of a system that works together. When you are getting messages like a rash, like eczema,
Hmm.
your body's obviously trying to have a conversation with you. So it's
Yeah.
coming out of your skin. So there is something going on inside of you
Absolutely.
to cause that. Let's not just brush this under the rug and say, oh, it'll pass. It's just a phase you're going through, like, no,
Yeah.
why is it there?
Yeah.
And why can't we dig deeper? And I think that that's one of the most frustrating things when
It
going to the
totally
doctor.
is. It's
Yeah.
very frustrating, and I have experienced it myself too. And I think this is really where education and empowerment as a parent, um, as someone who's advocating for either yourself or your child is so important, because no one's going to like give it to you for the most
Right.
part,
Absolutely.
in the traditional world. And so I love teaching and educating my parents of how to stick up for themselves and how to politely decline interventions, and how to really stick up for themselves and trust their intuition
I
that
love that you're
what
doing that
yeah.
because it's so important for the parents to be equipped to know what to say and
Hmm.
to have an insight on what could possibly be going on, and not just here's the band-aid to slap on whatever's happening.
Yeah.
Can you talk a little bit about what leaky gut is?
Yeah, so leaky gut is essentially, the digestive system is lined by what are known as enterocytes, which are cells that are one cell thick. So they line the digestive tract, and they're supposed to look like this. They're supposed to be very tight and interlocked. And when there's some level of damage to the digestive tract, they slowly or more aggressively separate like this. So those
Yeah.
cells start separating. That is what's called intestinal permeability or leaky gut. And some signs and symptoms of that are stomach pain, irregular stools. Um, those are kind of the most common, but definitely like food sensitivities, food allergies. Any skin condition is associated with intestinal permeability. I don't even really test for intestinal permeability in my patients. Based off of symptoms, you can kind of just assume if they have it or not. It is linked to, I would say, the majority of chronic illnesses.
Mm.
And the good thing is it's pretty easy to fix once
I
you
was going to
know
say,
it's
how
there.
can you start to fix leaky gut then?
Yeah, I think really it starts with diet. So pulling out processed foods, pulling out foods that may be irritating your digestive tract. And this is going to be super unique. Not everybody needs to pull out, say, organic gluten. But if you're eating a ton of non-organic gluten and you're finding that you have a little bit of a stomach ache, or maybe you have a headache after you eat those foods, that's a sign that your body is not tolerating that food well. And so usually I'll say pull those foods out for 2 to 3 months. um, Bone broth is amazing at healing the digestive tract. And so I will oftentimes recommend daily intake of bone broth or bone stock for my patients, eating lots of polyphenol rich foods. So blueberries and different other types of berries, pomegranates are amazing for the digestive tract.
Mm,
And then environment when we are eating is really important. So taking some deep breaths around mealtime to put us down into that parasympathetic rest and digest. Because if we're up in that sympathetic state, our body's not able to properly digest our foods, which
mm,
is going to contribute to worsening intestinal
I love that.
permeability. Probiotics have been shown to help heal the digestive tract. Uh, L-glutamine, which is an amino acid, has also been shown to radically help heal intestinal permeability. So I use that a lot. It's safe in very young kids as well as adults. And then
Yeah.
decreasing anything that can contribute to intestinal permeability. So different medications, definitely things like Tylenol in our pediatric population, that's very common, contributes to intestinal permeability. So again, there's a time and place for over-the-counter medications, but knowing when to use them and when we can use traditional methods or more natural methods instead, or as the first line treatment before having to go up to using things like Tylenol is
Yeah.
really important.
That's what I was going to ask. So when like some kids just tend to be sick a lot and then they'll go to the doctor and they're put on an antibiotic over and over again.
Yeah.
I'm assuming that's not good for the gut.
Yeah, it's definitely not great for the gut, and we know that depending on what type of antibiotic you're taking, can take up to 2 years for that microbiome to
Yeah.
actually regrow its ecosystem again. And what I commonly see is it will regrow the microbes within the gut. They do kind of come back to the microbiome, but oftentimes the ratios are not in the healthy ratios that we desire. And then after, say, multiple rounds of antibiotics, we then get mushy stools, or we get stomach aches or distension of the abdomen, or we get
Mm,
anxiety or skin
yeah.
conditions, right? And so really knowing when to use antibiotics and having a provider who's very mindful of utilizing antibiotics in a very safe way is
Yeah.
very important. And so
Absolutely.
for me as a provider, I do use antibiotics in my practice. I can
Mhm.
count on one hand how many times I've had to use it because natural medicine is so darn effective.
Right.
And when parents know how to use different herbals and at home therapies, we can oftentimes mitigate the need for antibiotics,
I love that.
especially
My
ear infections. Don't get me started on ear infections. 70% of ear infections are viral. And the amount of times I see parents that will go to their pediatrician and they'll immediately give them
Yep.
antibiotics, which is
Yeah.
not standard of care as of now. And there's so many other things we can do for acute ear infections. And so love teaching parents how to have a couple things at home to use in those acute scenarios so that you're not having to scramble, you know?
Yeah. Can you give a couple examples of like parents that are dealing with chronic ear infections? Like how
Yeah.
they can help do that?
Yeah, absolutely. So, diet is again for basically everything that comes in my door. We're talking about diet as a first line remedy. So, a lot of kids with recurring ear infections have food sensitivities to gluten and dairy. And so,
Mhm.
for kids that are eating a lot of gluten and dairy, I will oftentimes temporarily pull them off of gluten and dairy. And then
Yeah.
in replace of that, can we really focus on whole foods, high quality meats, fish, nuts and seeds, lots of diversity in fruits and vegetables? The goal is 30 plants in our diet, not daily, weekly, 30 plants. That includes spices. So if you're cooking with, say, like an Italian blend, you can really easily get up to 30. I think sometimes that 30 number
Absolutely.
feels very intimidating, but it's really doable.
Right.
In terms of lifestyle, if children become congested, they have nasal congestion, or they sound congested, the number one prevention for ear infections is clearing the nose, because the nose and the ears are connected. And so if the nose is full, that drainage is either going to come out the nose or it's going to go into the ears.
Mm.
So, what I tell families is, if we've got nasal congestion, number one, we got to clear the nose. And so it's going to depend on age. For young kids, say under 12 months of age, saline nasal drops or spray up the nose, gentle nasal suction with either a bulb syringe or like a nose Frida, it can be very effective. Herbal steam inhalations with things like thyme, dried thyme, is an amazing, it's very drying. And so if we've got a really snotty kiddo,
Yeah, yeah.
using thyme is amazing. And most people have dried thyme in their kitchen, you know?
Right.
And so throwing a couple tablespoons of dried thyme on the stove, putting a top on that pot, letting it come to a boil, taking that pot into the bathroom, creating a steam shower, then having the kiddo play in that shower, taking off that pot top, and then letting that herbal steam infuse into the shower is very effective. And oftentimes I say, do the herbal steam inhalation, then do some saline nasal drops, then do the suction, and then that nose will clear. In
Do you
older
think essential oil time would be good too? If you could put that in like the bathroom?
You definitely can. I'm just a little bit cautious of essential oils, especially in young children. So, if
Got it.
you are very educated on how to properly dilute
Okay.
and which ones are safe for young
Mhm,
kids, you can
mhm.
absolutely use thyme. I would not do that for a traditional herbal steam inhalation where we're leaning over the pot, because
Okay.
essential oils are much stronger, right? We don't
Yeah,
want to like burn the nasal cavities either. We just
that's
want
true.
some gentle drying action.
Yeah.
And then in older kiddos, doing actually saline rinses. They oftentimes don't love them, but they
Mm,
work like a charm.
yes.
And so that works really, really well. Then, at the first onset of symptoms, I have a very specific protocol that I put my patients on: garlic mullein drops in the ears,
Yeah.
elderberry syrup, usually vitamin D, maybe some zinc, and then eustachian tube massage with castor oil. So, really helping those ears drain
Yeah.
is incredibly important, and then keeping that nose clear. And usually, kiddos get over it like that.
Wow, that's amazing. I love all
Yeah.
those ideas. Now, when I was on your website, I saw that you have like, I don't know, like 7 or 8 main topics that you like to educate parents with. And one of them was complex picky eating.
Mm,
What is that about? Because I actually like, because I'm a preschool teacher, there are, I would say like 1 to 2 students a year that I'm like, what do you eat? Because you don't eat anything.
yeah.
So, what
That would be
exactly?
complex picky eating.
Yeah, what is that? And I also
Yeah.
like have one of my nephews. He almost seemingly gets like anxiety around food and eating and stuff. So I didn't know
Mhm.
if like that kind of fit into what
Yeah.
complex picky eating actually is. So can you explain what that is?
Yeah. So I don't love labels for our
Yeah.
kiddos,
Yeah.
but complex picky eating in general would basically be a child who is a very picky eater, who is selectively choosing to not eat very large food groups, maybe has some sensory aversions to either crunchy foods or really soft
Yes.
foods, and is just eating a very limited diet. It is a developmental milestone in those toddler years that they will become a little bit more picky. And that really has to do with independence. They're looking for that control. And
Right.
so in those years, I really try to educate parents of continue to offer those non-preferred foods. Really try to not take it personally, continue to offer lots of different diverse foods, encourage them to eat it, but don't force them to eat it.
Hmm.
Um, but in those kiddos that are older than those toddler years and they have not grown out of that, for me, that is not something to watch and wait about. I hear this from pediatricians a lot of like, oh, they're 4 years old, they'll grow out of it. And in my experience, they usually do not grow out of it, they get
Oh,
worse. And
yeah.
so in our office, we have two feeding therapists in our office, and they're both phenomenal, and they work on oral motor control, they work on sensory aversions, they create safety around food, which is really important for a lot of kids, is
Mhm.
the safety aspect. Like you
Right.
said, they feel like you may be picking up on possibly some anxiety around foods, and
Yeah.
oftentimes that's correct. They do have anxiety around foods, and um, it may not be the parent's fault that they have
Right.
anxiety around
Right.
food. I think
I
a lot of
wondered,
parents,
like, my friend said something to me. She's like, well, people like kids that are older that might have like this food aversions. Could it have been that maybe like when they were a toddler, they choked on something and then developed this story around food and they don't know, you know what I mean? Could it be something
yeah,
like that?
it could. That's not I would say, a common reason why children have really complex picky eating.
Mhm.
Oftentimes, it has something to do with oral motor control. Sometimes kids
Okay.
have a really strong gag reflex.
Yeah.
And if they're not using their tongue properly, then they're getting that feedback from their body that they're almost gagging on a regular
Yes.
basis with foods, which oftentimes they're not able to communicate that, right? And so I think a
Right.
proper oral motor evaluation. And that's why I send to my feeding therapist on a very regular basis to at least get a baseline evaluation of like, how are they using their tongue? How are they using their mouth? What are they doing with the bolus of food in their mouth? How do they talk about foods if
Yeah.
they're verbally communicating? But there's a lot we can do with picky eating. And I think
Yeah.
um, there's a lot we can do as a full family as well, right?
Yes.
Because
I,
it affects the
yeah.
whole family. It's not
It
just the
it can
child.
be like you sit down to have a meal and you have one of your children that are like absolutely not like I don't like the texture, I don't like the smell, I don't like the taste.
Yeah.
It's not even that I don't like it's like they literally are, upset, you know what I mean,
Yeah.
and scared and nervous and anxious about it. So it's like,
Yeah.
this is your mealtime that you're coming down to, bond with each other and then you've got this going on.
For sure.
And
And I think
yeah.
it's even more frustrating for parents that are providing really healthy meals and they're like,
Mhm.
"Oh my gosh, like I am, making all of these meals. I'm preparing really healthy foods for you and they're not touching it." Right? This is
Yeah.
really really taxing emotionally for parents. And so I talk a lot again about that mind-body connection with parents of like what's going on inside you? What's being
Yes.
triggered in you when your kids are saying no to these
Oh,
foods?
I
Because I
love
think that's just as important, right? For
Yeah.
the
Yeah,
parent to
what are
be
you
doing that
feeling
work.
inside? Absolutely. Could
Mhm.
help get to the root of that. My
Mhm.
last question is, we talked about it's a little controversial, so I'm not gonna like, um, we don't have to go too far in depth with it, but I feel like as a parent now, it just seems more and more scary to have your little ones going off to school and they have to have all these vaccinations before they can go to kindergarten and then, first grade and all the things.
Yeah.
Um, what are your thoughts on all of the vaccinations that kids are now like having to have before they can even go off into school? And because like you and I were just talking about like detoxing and stuff and how every body is different, my opinion is in the way that how my body detoxes like heavy metals and toxins and all that is going to be completely different than the person down the street, than my
Yeah.
husband, than my two kids. And so therefore each child is going to be completely different. And I feel like some systems can get bogged down so much quicker. Is that like a
Mhm.
true statement or, how do you
Yeah.
feel about all that?
Yeah, I'm definitely concerned about the number of vaccines that we are giving our children now compared to the
Yeah.
late 1900s,
Yeah.
and the number of vaccines that we're giving our children are a lot.
Yeah.
And that does concern me. I, in my practice, the way I view it is I really believe in true informed consent. I believe in our parents being educated, having a really safe place to ask their questions, because
Hmm.
oftentimes pediatricians don't have the time, and oftentimes they don't have the bandwidth to actually answer the questions that
Right.
our parents have about these topics. And I think it's incredibly important that our parents are questioning
Yeah.
what's in those vaccines. How are we giving them? How is the child reacting? How are we supporting their immune system? How are we supporting detox depending on the supplement or depending on the vaccinations? And how are we supporting our children through this process? I
Yeah.
look at vaccines as just one part of the toxin bucket, right?
Hmm.
But it's not all vaccines. I think
Right.
some people will blame everything on vaccinations, and I do
Hmm.
not agree with that. I think it's
Yeah.
just one large drop in the bucket that
Hmm.
we need to be thinking about that drop in the bucket, but we also need to be thinking about all of the other drops in the buckets, right? What's
Right.
in our food,
Right.
what's in our water, what's in our environment, what's in our air that could also be contributing to eczema, allergies, autism, you name it, all of these chronic illnesses that are really on the rise for our children. We need to be looking at all of it. And
Yeah.
how do we, as parents and as providers, how do we lower that toxin bucket for each person? I think that's really, really important. And secondarily, is every child is different.
Hmm.
Every
Right.
child is different, and I think the vaccine world, and I think a lot of healthcare is portrayed as black and white, and it's
Right.
not black and white. There is so much gray, and I love talking about the gray. I think the gray makes a lot of people feel very uncomfortable, and in my practice, we love getting into that gray area
Yeah.
because we
We
have to
need
get
new
into gray.
solutions. Absolutely.
Yes, like what do we have literature on? What
Yeah.
research has not been done? And what can we make of that? Where is our risk tolerance?
Yeah.
Right. And so I am not anti vax. I'm not pro
Mhm.
vax. I'm true informed consent and really providing that safe place for parents to feel comfortable and um, like it's okay to have those conversations and
Right.
not get gaslit, because it's a
Yeah.
very common conversation where parents are being gaslit at their
Right.
pediatrician's office and being thrown with CPS allegations and things like that. That's very scary.
Right.
And in my practice, that doesn't fly. That doesn't
No,
fly.
absolutely not.
Yeah.
Is there a way that you suggest, like, say a parent's like, okay, I know that my kid's going to go off to kindergarten, so I know that I have to have these vaccines. Is there a way that there's a way that's a little bit less of a toxic load on them? Like, would you suggest? Because sometimes, like, I remember when my kids were little, when I would have to go get them their vaccines, whatever. Sometimes they'd do like three in one day.
Yeah,
Like,
for
would it
sure.
be better to like kind of stagger it where you're only doing one per day, but you go to the doctors three times instead of one? Or does that not even work?
Yeah, so a lot of my families do choose to do delayed or alternative schedules. It's really going to depend on the goals of the parent as well as what are the regulations in the area, right?
Mhm.
In the state of California, we have one of the most strict legal bills around vaccinations in the
Yeah.
country, and so a lot of my families are kind of forced, if they need to put their child, say, in daycare, they kind of don't have a ton of wiggle room.
Right.
But there are ways to optimize the way that we give them, and some of that does mean giving them individually or kind of cherry picking which ones are most important in the first year of life, right?
Yeah.
For me, we usually think of HIB, PCV, and DTaP in my office. Those are kind of the most important in the first year of life because they're all upper respiratory tract infections, and in
Mm.
very young infants have the highest risk of hospitalization and death.
Mm.
So in my practice, if we have the ability to kind of cherry pick which ones we give at which time, oftentimes my families will choose to give those in that first year of life and then
Yeah.
kind of add on the other ones after that first year of life when the risk is a little bit lower, if that
I like
makes
that.
sense.
Yes, it
There
does.
are ways to kind of navigate that. There's also some CDC, what I call the fine print. That's all CDC guidelines that with DTaP and polio, you can drop one dose if the
Oh,
last dose is given on or after a certain age. And so there are a couple that you can drop a dose, which can also be very helpful in terms of, the greater toxic
right,
burden.
right.
So I love to educate on this. I think one really great resource is the Vaccine Friendly Plan book. A lot of my families read that. I also do offer individual vaccine consultations where I do a ton of educating, and it's a 60-minute consultation where we basically talk just like this on
Hmm.
what vaccines are available, what are your regulations in your area, what are your options, and then answering all of your questions. We will also be having a ton of vaccine conversations on Healthy Families Collective, my membership.
That's what I was just going to say. So I love that we were just, I could talk all day about all this stuff, but I know you've got patients to go see. So, how can the listeners find you, number one? And number two, why don't you go ahead and tell them about your big announcement?
Yeah, absolutely. So you can, my website is youngmedicine.com. You can also find me on Instagram at Dr. period Michelle underscore Young. And we are, or I am launching a online membership app come April 15th. We are launching, and Healthy Families Collective is really a community for health conscious parents that want to be proactive about their family's health to prevent future disease, while also wanting to learn how to use natural remedies, or how to use diet and lifestyle and different supplements, and feel very confident using natural medicine for things like earaches, coughs, colds, diarrhea,
Love it.
molluscum, hand, foot, and mouth, you name it. Basically, I have provided all of my protocols on there. I'm kind of, working myself out of a job, but for me, it is incredibly important that parents know
Mhm.
how to use these tools at home and they feel comfortable and confident, but they also know how to use natural medicine when it's appropriate. And they
Right,
also understand, when do I need to seek higher level care, right? And so we go through red flags, and when is it appropriate to call our pediatrician or go to the emergency room, because oftentimes that's a little bit of a gray area and feels scary for a lot of
right.
parents. And so I talk about that in depth on that platform. We're also going to have a live podcast with tons of amazing experts. So excited about that. It's been something that people have been asking from me for a while. And so we are going to have that directly on the app for members. There's going to be a live Q&A with me. And so you'll be able to, if you're a member, to ask your questions and get your questions answered. And then we also have a weekly breathwork session for parents to really pour into themselves, get a little bit of a boost on Monday mornings. And then everything is recorded. So if you can't make anything live, everything is recorded for you to listen to later. So I hope you can join. It's called Healthy Families Collective. You'll be able to find that in the link in my bio on Instagram, as well as my website.
I love that so much. So if somebody had a question, but they couldn't make the question and answer live that you have, is there a spot in the app where you can just
Yes.
post a question when you have one? Oh,
Yes,
I
yes.
love
So
that.
we'll have an open discussion. So I'll be basically answering questions all the
Oh,
time on there. It's
nice.
kind of like a
Oh,
Facebook group where it's just, you'll be able to see all of the questions. So you can post them there. We'll also be collecting questions ahead of the live Q&As. So people will be able to input their questions, and then I will have a list of people who are either live or not live that I will be answering their
right.
questions.
Like what an efficient way or app to have, because we were talking about this before we even jumped on the podcast. You're going to be able to really decipher if you really need to go to the doctors or not.
Yeah,
You really might be able just to figure out what's going on through the app alone and
absolutely.
save yourself a trip. I love that.
Yeah, absolutely. Yeah, we are so excited. It's been years in the making. I'm Yeah, I'm excited for it to go global. We've
Yeah.
already got people in it that are from Saudi Arabia, and we've got a couple Europe families, and so it really is not just for people in the
Yeah.
States. It
Mm.
is available for everybody. It is for the parent who maybe already has children who have some symptoms, maybe allergies or asthma or eczema, that are looking for a different way to approach it. Um, and it's also for families that want to keep their kids healthy.
Yeah.
I feel so darn passionate about that, especially
Mm.
as someone who is handling chronic illness as an adult. And I know that the way that I was raised, my parents did their absolute best,
Mm.
and the way that I was raised, the way I ate, the stress levels, the way I handled emotions, my sleep, all of that I know contributed to my current health condition.
Yep.
And so I want to pass what I have learned and what I know to be true and what the research shows on to parents so that they can do better.
This is amazing. You're going to be changing so many lives, which I
Mm,
loved to be able to meet people like you that, can kind of spotlight what you're doing and just help with that ripple effect. So
thank you.
I'm so happy that you are going to be starting this and you're going to be helping so many people.
Thank you so
That's
much. I'm
wonderful.
so excited.
Oh,
Thank
well,
you for having me on.
yes, thank you so much for being on here. And to the listeners, I really hope that you got some really good, juicy information that you can start using in your everyday life now and go out and get this app starting April 15th.
Yes,
So, yes, and
absolutely.
you need to go follow Michelle because she has so many amazing little tidbits and gems right on Instagram. So,
Thank you.
you
Yes, I
know,
share lots of free info on there.
yes,
So
yes. I just love it. Well, Michelle, thank you so much for being here with me.
thank you for having me. It was such an honor.
All right, to the listeners, see you again next time.